Okay, so hello everyone, and welcome to our Parenting Live series today. I'm Dr. Prathna Singh, and I am from Dr. Ola's Wellness Hub, and I'm here joined with the lovely Nisha from Singh together. Thank you,
Hello,
Nisha, for
thank you for
being
having
here
me
today.
today.
You're most welcome. Yes, I'm glad to be here as well. And today we're going to be talking on the topic of anxiety and fears in children. And I'm going to be speaking a little bit from my perspective as a psychologist and how I go about helping children and families in terms of that. But I'm happy to hear any questions or anything that you think might be useful for me to share with our viewers today.
Absolutely. So obviously I'm from Send Together, which is our mobile application, and we have a community of parents who have children with additional needs and disabilities. So we often have questions that come from the community around phobias and fears. So this is excellent for us to kind of deep dive into that a little bit more. So thank you.
Perfect. Great. Okay, so Anisha, do you have any questions to start us off about this topic?
Yeah, yeah, sure. It'd be great to hear from you a little bit more about the types of phobias and fears that you have dealt with in your practice. And if you would like to tell us a bit more about what a phobia is, I suppose for people who are not aware of that, that'd be great.
Yeah, definitely. So we know that it's actually very common for children to have fears and to have worries and to have anxiety. That's quite common. But what we also know is that sometimes these fears can actually be very intense and they can be very persistent. And sometimes children can develop fear about something very specific. So it might be a specific thing or it might be a specific situation. And if this is very persistent, very intense, and sort of disproportionate to the situation, and the level of threat is not, the perceived threat is not actually as significant or severe as the actual threat, that's usually when we might start to wonder whether a phobia actually might be present. And also, a phobia might be present. Something also for parents to be mindful of is that sometimes a phobia and these intense fears can start to impact upon a child's daily routines. They can start to impact upon their daily functioning, and they can start to impact and impair school functioning as well. So we look at the level of impairment as well when we are considering whether something is whether a worry is developing into more of an anxiety, and whether again the intensity and the persistence of it for something very specific, that's sort of a phobia that we will be thinking about.
Yeah, that's really interesting because often it's natural to fear things like that's a really human reaction to situations. And I think
Yes.
from our it's a bit like when, like you've just mentioned there, when does it become a phobia? Like where is the line in there? And you've explained, it could be, the irrationalness of the situation, as in it not being proportionate to maybe the consequence, and that's what the worry is. So that's
Yeah.
what kind of other flags would parents look out for?
Okay, sure. So, and just to go back to that definition of the phobia as well, is that it tends to be something very specific that a child will be worried about. So, some examples, because this might actually be helpful if I give a few
Mhm.
examples. So, some examples of phobias might be a child who has a specific fear, an intense fear around animals. So, for example, a phobia might be around cats or dogs, or might be insects like spiders. Children can also develop phobias around medical procedures and medical settings, needles as well. Maybe they've had a very distressing and upsetting experience previously, and now they have this very intense fear about something very specific, like getting a vaccination or having to encounter a needle in any sort of situation. Sometimes children might also experience phobias about swimming and about water. Other examples include heights and elevators. And also, children might also experience phobias with vomiting as well. Maybe they've had a very unpleasant experience and they now fear any situation where they might be vomiting might be involved. So those are some
Yeah.
examples, and yeah, parents can keep an eye out if they're developing that specific fear on something very specific.
And that's really interesting because I was actually speaking to a parent, a mum, not a few days ago, whose child has a real strong phobia of vomiting, like you mentioned, but the
Mm.
mother can't trace it back to a situation that their child was exposed to something, so they're really puzzled into where is this developed from. So often is it could it be that they've experienced something, or could it just be that they've had thoughts around it? Could a phobia
Yes.
develop in that time as well?
Yes. So sometimes children will actually have the direct experience of going through that very unpleasant experience, but sometimes they actually might witness it or observe it in somebody else. So they might observe somebody else's experience of it. So maybe they've seen it somewhere else, or maybe we're not aware that they've seen it, or maybe somebody else has modeled it for them and they've picked up that fear, and then it gets translated later down the line. So it can be modeled, it can be, yes, there can be thoughts that maybe they've seen other children go through it, and it can exactly develop into a phobia.
And in your experience, is it best to kind of tackle the phobia head on earlier rather than later? Do you feel like the intensity and the length of time that it goes on, does that make it harder then to kind of undo those phobias?
Yes, I think early intervention is always encouraged. If we're picking up something and we're seeing that there's a high level of distress, there's a high level of impairment, I think it's very important for us to get on it, to observe, first of all, what's going on, to keep an eye on it. And
Mhm.
if we see that there is indeed that level of intensity and impairment, it's very important then to try to seek professional help. And I think it's also important because sometimes I think as parents, the gut feeling or the instinct might be, oh, well, I need to actually encourage my child to have exposure to this, and I need to really push, and I need to get this over and done with, and help them to move through this fear. But I think we need to understand that the treatment of phobias is actually a gradual process as well, and it's not something where we're going to flood children or we're going to cause even more intense feelings. So it's something that actually needs to be done in a measured way, and that's where I think a professional will come in to actually help. So and I think this lends to the whole idea of actually, as professionals, there are different approaches that we use as well, depending on the needs of the child, the specific needs and the specific developmental profile of the child as well. So we have to take all that into consideration when we're helping children move through their phobias.
Yeah, and I think what you just touched on there was really interesting because we have this cliche, don't we, of face your fears, and that's inbuilt in us. You hear this when you're like, no, come on, I can climb this mountain, or I can, go into this water or what. But I think that what it's really important for parents to highlight, facing your fear is not the same as facing your phobia. Like you said, you need to do that maybe really sensitively and in a way that's not going to be safe for the child, because the worst we want to do is expose and then amplify that phobia even more and make those worries even more kind of concrete for a child. So, can you tell us a bit about the kind of treatments that um, do for children or families who are experiencing phobias?
Sure. So one of the common approaches that have been used is something called exposure therapy. And that's exposure therapy and CBT, exposure and response therapy and CBT. So that's actually helping children with their thoughts around their fears and gradually exposing them to their fears. However, there is also an increasingly popular mode of treatment for children, and this is called EMDR. So EMDR is a short form for actually a very long, it's long terminology, but it's called I want to make sure that I got it correctly.
On the spot.
EMDR, so eye movement desensitization and reprocessing. So
Okay.
that's quite a mouthful, but I
Yeah.
think that it's important for us just to understand the basics of it. So EMDR is basically has this understanding that the memory, so there might be a memory and that has triggered or that is causing this distress. So this memory gets stuck in the brain and get stuck in the body. So that's the understanding. And so EMDR actually encourages what we call bilateral stimulation. So these are back and forth movements. So the back and forth movements might be the moving of the eyes, it might be marching of the feet, it might be tapping of the hands, it might be moving the body in a particular way. Because again, the premise is that this memory, this distressing or upsetting memory, has somehow become stuck in our brains and in our bodies, and we need to try and shift that and move that. We want to get the two sides of the brain talking to each other and lighting up. So the irrational part of the brain and the emotional part of the brain which is oftentimes with memory is, and the rational part of the brain. So the more thinking, the more logical part of the brain. We want to get those two parts of the brain talking to each other. And so we do that through this bilateral stimulation. So we get the child to bring up a memory if there is one, and then we are going to help them, and they're going to be doing the bilateral stimulation as they're doing that and as they're moving through that. And that helps to shift the memory and get the memory, as we say, unstuck from the body and from the mind.
Wow, really
Mm.
interesting. Yeah, really, really interesting. So I suppose finally, would there be any kind of advice you would give to parents who are maybe anxious or hear this and feel it's quite scary to embark on this therapy, either of the ones you've mentioned, for their child? Is there any things they should check in for, or any words of advice you could, hints or tips you could provide the families with?
So I think that it's really important just to be vigilant, to be mindful, to pick up things if there are things there, but not to panic. Know that there's always help available. There are always professionals around who are there to support you. And of course, as well as a parent, it's really important to be able to model behavior as well, because children are going to look towards you, how you're responding to those fears, how you're responding to those worries and phobias. And so your self-talk and the way that you talk to your children about this is also very important. So just being mindful and being in that space of being able to co-regulate for your child, I think can really go very far in helping your child through these worries and these fears.
Amazing. Oh, that's really, really useful. I've learned a lot myself, so I'm sure our listeners and watchers will be equally as interested in what we've covered today. So thank you very much.
Thank you so much, Nisha.
Take care.
Okay, take care.